Hey guys, welcome to another episode of Darshan Talks. We're continuing the last conversation where we started discussing patient engagement. We spoke to Trishna, we spoke to Nirpal, and we're going to jump in deep right now, and we're going to start talking about patient centricity. And we're going to talk, Nirpal in the last conversation just hinted at this idea of bringing the right players to the group and getting the right voices heard. Before we go down that path,
this is the Darshan Talks podcast, regulatory guy, irregular podcast with host Darshan Kulkarni. You can find the show on Twitter at Darshan Talks or the show's website at darshantalks.com.
Trishna said something really interesting that I want to explore, which was, Trishna, you mentioned that there's a global community around patients, and you talked about how you're involved in that global community. How organized is that community?
So it's becoming much more organised. There are, sort of cross national, cross regional organisations, and so, for example, We Go Health is a community. It's an online community where patient advocates can share experiences. They can, they do various courses and things like that. You have in Europe, you have UPATI, which enables you to gain essentially a qualification, a patient advocacy qualification in the R&D process. And then there's others, like, for example, you've got organizations like patient-focused medicines development that's working again across patient communities. It's looking at some of those overarching issues that affects the drug development life cycle, but looking at it from a patient-focused angle. So, things are becoming much more organized. I think technology has really helped because we have that ability now to engage with others online. I regularly chat with people from the US, from all over Europe, which in the past wouldn't have been possible because the only time you would really meet people would be face-to-face at conferences. Or in, projects or meetings, etc., etc. The internet has really facilitated that bringing together of advocates from, all over the place. And it's allowed us to share experiences. Also, how do we overcome challenges? Because there's still many, many challenges in this area. It's definitely becoming easier, I think, in order to engage with other advocates. And I think that's a good thing because I think, if you've got a weight of voice behind you, that makes it easier to facilitate change, especially in an industry which is as large as the pharmaceutical industry. Trying to change things can be difficult if you're a lone voice.
Fair enough. So that brings us to Nirpal's point then, Nirpal.
Yeah.
Nirpal, here's my question.
Go on.
In your opinion, your experience, do you see all patient advocates being the same, i.e. are people in many ways have been treated like widgets where I need a patient, insert patient here? Has that been your experience, or do you kind of feel like we are treating patients with the respect that they deserve? And Trishna, I'm going to obviously bounce back to you to see what your take on that is.
Yeah, I think that's the way we want to go. I don't think we have got anywhere near that yet. I agree with Trishna. There's been progress, of course. I mean, there are now roles, as Trishna, you mentioned. So definitely there is a movement around understanding that there needs to be a coordinated engagement, and there needs to be a very high level of leadership that represents the fact that sponsors need some sort of engagement partnership with patients. Now, from my experience, what I'm seeing is that journey seems to be a very slow pace. We still think about patients in the research world as, well, we need to guide patients and we need to tell them where they need to be engaged in and how, and it's limited. And one of the very interesting things you just mentioned, Trishna, is it's where my thinking is and where synchrogenics thinking is. It's the weight of the patient's voice. You're mentioning examples in which there's mechanisms in which you're trying to get more of a broader voice so that you have sort of a weight in numbers to get your opinions heard. And that's where we feel it needs to go within research, and that's why our thinking is you can't just pigeonhole specific patients that you may not even understand have a direct correlation with what you're trying to do, and have it in such a limited way, and as I said before, tick in a box that you've met that expectation. I think there needs to be a broader way in which you can engage patients like we do in social media. Embracing that in research, mechanisms in which you can solicit feedback from the widest amount of audience as you possibly can, partnering with groups that actually have numbers of patients. We won't pretend, and I don't think sponsors can pretend they have all patients represented. I think when it comes to research, they've probably got less than 1% of the overall population of that disease state in the first place. So trying to make that net wider, in which you can provide platforms that are based on the principles of social media, is where I feel we need to go, and is where I am steering our organization to go, where we can get that broader collective that can participate in whatever means it is. If it is around their participation in a trial, I think that's a very rudimentary use case. There's, I think, many earlier parts you can work through in development, especially around your study designs, your protocols, where you really do need to engage with patients to get their perspective before you put these things together, so that you are meeting those objectives and really, you are facilitating the need of the patient.
Go ahead, Trishna.
So I was going to say, because Darshan, you had spoken about, do we lump basically all patients together? And I'm still seeing that a huge amount in industry. There are very, very few pharma companies that I've come across that actually recognize that not all patients are the same, and not all patient advocates are the same either. Plus, that there's a difference between engaging with patient advocacy groups and patient associations, charities, etc. And there's a difference between that and engaging with individual patient advocates. And then within the individual patient advocates, so the patient community itself, so I like to think of there being three different types of patients. You have the vast majority of people who are patients by experience. So there's somebody who's been diagnosed with a condition. They're maybe informed enough to live with it on a day-to-day basis, or maybe they're not informed at all and are just doing what their doctor tells them to do. And they have experience, they have knowledge of their own experience of their condition. You then have expert patients. Now, they're knowledgeable about their own experience with their own condition, but also the experiences of other patients within that community. So, for example, say it's multiple sclerosis. An expert patient in multiple sclerosis will know about their own experience with MS, but will also be knowledgeable about the issues and experiences that are affecting other people within the MS community. So that's...
Hold on, Trishna. Yep. I want to take this second to put a little bit of a cliffhanger. So we've discussed two types of patients. Listen to the third podcast, and we'll tell you about the third type. Thank you all for listening in. Nurpal, I'm not going to give you a last comment because we went over the last time. We're going to continue the conversation. Stay tuned. Thanks, everyone.
Thank you.
This is the Darshan Talks podcast. Regulatory Guy, Irregular Podcast with host Darshan Kulkarni. You can find the show on Twitter at Darshan Talks or the show's website at darshantalks.com.